We're very lucky in as much that we have a group here called Friendly Faces. They're a group of people that have been bereaved, people that in their families or friends that have died with us, and we offer them bereavement counselling. We also have a helpline that people can ring. But what we learned from these people were as great and as helpful as the bereavement counselling and the emotional support is. Actually, they wanted a social group as well, to be with people that have been through that same emotional journey. So we created Friendly Faces, and I went to them and I said, what did we do that really helped you after your bereavement? Because hospices generally, we focus very much on the emotional impact that somebody is going through having lost somebody they love. So the helpline, the bereavement support is vitally important to them. So we asked that question, and people said it was great having somebody that understood and listened to me one-to-one, and I could share my innermost thoughts and fears and feelings. Sometimes that's hard to do with people in your family or your own surroundings. It's far easier to talk to somebody maybe you're not emotionally involved with. So complementary therapies helped them greatly, as did knowing that we were here for them. But then I asked the question, what didn't we do that could have been helpful? What didn't happen for you following that bereavement? And this is when we learned so much, because there were tasks people were facing in a time of grief that they couldn't cope with. So these are some of the things they told us. Dealing with paperwork, that became very difficult, and that was from even the death certificate, the arranging of the funeral, dealing with pensions and all of those bureaucracy things, really, that people are left to do very much on their own. Some gentleman said sending my wife's blue badge back, her disabled badge, was heartrending. That's something that perhaps somebody else could have helped them with. But then we came to tasks such as, I found myself having to go to Tesco's or shopping, buying for one person instead of two, and how difficult that was. Putting things back on the shelves because actually that was the person that I've lost, that's what they would have bought. And then going home and cooking for one person, some people not even bothering because there's only one person left. One gentleman said, I couldn't even boil an egg. So having somebody there to perhaps prepare a meal with and sitting there and eating it with them, because one of the most lonely and isolating things we have now understood is eating by yourself can be a very, very sad time when for years you've sat and eaten with somebody else and had that conversation, and suddenly you're on your own. So other tasks such as, like one lady said, I can't change a light bulb, I'm too short, something my husband always did. So we suddenly realised that actually we need to help people with tasks. So we're now developing a buddy scheme so that, as well as the emotional support our family services can offer as within the bereavement counselling, we can actually now work beside them and offer help with these tasks. So we're recruiting volunteers. We've had our first training has now finished, and our buddies are good to go and actually go to people's homes and help with those tasks that people are finding so difficult. We're part of the voluntary sector, and we work closely with our partners. So yes, it's great to be able to refer and signpost people. And one issue that I think people do find very difficult is when you've been in a partnership and you're left alone, socialising is very difficult. And we have some amazing friendly social groups out there, but to go on your own is a no-no. I mean, that is really difficult to walk into somewhere very new, not knowing anybody. So our buddies will they will actually go with them, take them, settle them in until they feel safe to go it alone. Introducing them perhaps to new hobbies that they may have never thought possible. So our creative therapy group, we have a walking group, we have a writing group, introducing people to those things that they may never ever have done before. And future volunteering. Many of the people that we've helped a couple of years down the line may think, actually, I'd like to go and volunteer with Saint Francis Hospice. They helped me. I'd like to go and help other people. So in my role as service development, I have to be thinking of new ideas all the time. And we thought, buddies, this is what we need. Out more in the community, working with other agencies and signposting. So we were very fortunate. We applied to the Masonic Foundation and they understood where we wanted to go with this. So have funded us to a degree in helping provide this brand new service. And that's about recruiting new volunteers, getting them trained, the marketing of saying, this is what we're doing, this is where we are, and making sure our other health professional partners out there know that these services are here. We don't just have an inpatient unit, we have so much more than that. 85% of the work we do is out in the community. Sometimes people might not be comfortable coming back here afterwards if they've lost a loved one here. So again, that's important that our bereavement team, our buddy team, people can actually complementary therapy. We can go out to them. Another great thing about the hospice movement is we all have our own tragedies as well. We're all human beings. We have, our own personal sadness and our own difficult journeys. Working here is just amazing because we support each other so much. It's just, we're just here for one another. And I think that enables us also to do our jobs well because we are cared for and looked after. That enables us then to do a good job. I think their recovery is going to be a better one, a better journey for them because there are a lot of people out there alone. To have somebody come into your home and share that with you and do some of those very difficult tasks has got to make life so much easier. And they say, sharing a problem halves a problem. And if it's that somebody can't use their washing machine, they don't know how to, small jobs around the house that they find so difficult, we are there for them. So I think buddy is a great terminology for what we're trying to do. We couldn't think of a better word other than let's just come and be your buddy for a while and pick you up, help, and then when you feel ready, you can move on.